When you wake up, doctor, from a medical operation, that is the patient, you may be aware of what? Well, the patient may be aware of an oxygen mask. Anything else? Also, a drip connected to a vein in your arm through which drugs and fluids are administered until you can start drinking properly. Anything else? A blood pressure cuff around your arm which may inflate automatically from time to time. Anything else? An oxygen monitor clipped to your fingertip or a pulse oximeter. Anything else? Dressings over your wound. Anything else? Drains collecting excess blood from the site of surgery. While the surgeon, doctor, and assistant scrub up, meaning that they wash and disinfect their hands and lower arms and don sterile surgical gowns and gloves, you will be laying on the open operating table in the correct position. Is that correct? Well, sterile drapes will be placed over your body, yes, so that just the part of your body to be operated on is exposed. Now, doctor, you may have a catheter inserted into your bladder to drain away any residual urine. Is that correct? This may be a quick in and out procedure, or the catheter may be left in place for the duration of a major operation. Doctor, does the surgeon cleanse the skin? Yes, the surgeon cleanses the skin around the operating site with a strong antiseptic such as povidone iodine. And, doctor, before the surgeon closes the incision, once the operation has been completed, the number of sponges, needles, and gauze swabs used are carefully counted, are they? Yes, they are. Why is that? To ensure that all are present and that none has been left in the surgical cavity. Doctor, you are usually given some preventive drugs during or at the end of surgery? Yes, these may include prophylactic antibiotics, an antiemetic that includes stopping your being sick, antacids to reduce the risk of peptic ulcers and inhalation of stomach acids, analgesics to reduce post-operative pain. Doctor, when you wake up, you may be aware of an oxygen mask? Yes, a drip. You will be closely observed by nursing staff, won't you? Well, immediately after the operation while you come around from a general anesthetic. Your blood pressure, pulse, respiratory rate, and temperature will be monitored and recorded regularly. Is that correct? The wound dressings will be checked. Also, the amount of fluid draining from the wound site of the catheter will be noted. That is correct. Don't be too concerned if you can't immediately move or feel part of your body. Is that not correct? As it can take a while for the anesthetic to wear off, especially if you have received an epidural, spinal, or other type of nerve block. Doctor, it is important that you reserve regular, adequate pain relief. Is that correct? Well, let the nursing staff know if you are in pain, as they can vary your dosage, change your analgesic medication, and give anti-sickness drugs if necessary. Also, doctor, if you are provided with patient-controlled analgesia, that is PCA, you will be given a button which, when pressed firmly for a few seconds, delivers a dose of analgesic. Is that correct? Well, don't be afraid to use this regularly, exactly as advised, as it is easier to keep pain at bay than to get on top of it once it returns. Doctor, if you feel sick or dizzy, do you try taking a few deep breaths, as oxygen can help to reduce these feelings? Is that not true? If they do not go away, tell the nursing staff. And you may be advised to perform deep breathing to keep clear your lungs and reduce the risk of a chest infection. Is that not correct? That is correct. How's it?
That's fine.
That's his book, Operation.